Hi, I hope you're having a really successful meeting in Nigeria. It's a great pleasure to be able to just talk to you briefly about UHC 2030 and especially what we're trying to build around civil society involvement in that new movement. My name's Simon Wright. I work for Save the Children in London, and one of the roles that I've got is that I'm on the steering committee of UHC 2030 to represent northern civil society organisations. There's two other members of the steering committee. One is Santosh Kumar Giri from India and Rosemary Mburo from Kenya, and they are also representing civil society, the whole of global civil society, on the steering committee. And we're also trying at the moment to build an advisory group to work together, and there are applications out at the moment for anyone who's interested in joining that small advisory group, which will make sure that the positions we're representing at meetings of UHC 2030 are endorsed and supported by the broader civil society. So if I can just say quickly what UHC 2030 is in my view. It's a new partnership coming together, hosted by WHO but also with the World Bank. And its aim is to try and ensure that many more countries make much faster progress towards achieving SDG target 3.8, universal health coverage, everyone getting the essential healthcare they need without being pushed into poverty by the way that it's paid for. So that's obviously an enormous task. And one of the things that is attempting to help that is to reorientate what used to be the International Health Partnership Plus, which was a partnership between donors and recipient countries to try to improve the way that aid was given so that it supported national health systems and not just whatever the donors felt like. But the IHP Plus, after several years, is now becoming UHC 2030. And UHC 2030, this new partnership, has a very different focus. It's not just about donors and recipients anymore. It's much more about what national governments can and should be doing. The resources for universal health coverage, especially in a country like Nigeria, are not going to come from donor aid. They're going to come from fair taxation, capturing a fair amount of the economy into the public budget and spending that money to build healthcare for everyone as an entitlement, not as a privilege for those that can afford it. But we know that many countries, Nigeria included, have a very long way to go before they get there. And so a partnership which collects best evidence, makes recommendations, holds governments to account, is going to be really important. But that's the global level. We're very, very concerned as we build the civil society constituency of UHC 2030 that it also has a focus on national level change. Ultimately, it is the relationship between citizens and the state that affects whether a government does what it needs to do to build universal health coverage and to respect the right for health. And so we need a very strong civil society in every country that is able to engage with its government, hold its government to account, and insist that health is a right and not a privilege. And that means looking at things like the amount of money that governments are spending, or are governments leaving it to out-of-pocket payments, to user fees, to going at random to the private sector, or is government taking their responsibility to collect money fairly and spend money fairly so that everyone enjoys the right to health? And that's where you lot come in, because in Nigeria you already have a very vibrant civil society, but that need can be stronger. And UHC 2030 needs to play its part in supporting Nigerian civil society to become a much stronger movement to hold its government to account for the right to health. So I hope you have a very successful meeting. I hope many of you will see UHC 2030 over the next coming period as a real addition to what you're doing and something that really helps the work that you're all already doing for the right to health.